We all had a fantastic lunch break, which is very timely to have our gut health session, basically when other people are eating and not caring about their gut. As some of you might know, 70 to 80% of the immune system is actually in the gut. So it's very important that we all think about it, because having a healthy or unhealthy gut might actually make or break your health. Now, I'm joined on stage by a fantastic, very diverse panel, ranging from people who still practice every single day, to investors, to founders, to serial founders. So I think we'll have a great discussion. And if at the end you have any questions, feel free to raise your hand and let us know. Now, what I would love to do is to start with you, Bobby. As you're a practicing endocrinologist, maybe you can talk a little bit about why gut health is so important, besides the statistic that I just mentioned.
So gut health is incredibly important in terms of it's how we get our nutrition, and you know, fundamentally there are a very broad range of symptoms that can occur, whether it be things like reflux and irritable bowel syndrome through to cancers. And you know, these cancers are preventable, so there's a lot that we can do within gut health itself. A lot of immune conditions, so things like inflammatory bowel disease, Crohn's disease, celiac disease, these are all important conditions that involve the GI tract.
And as far as I know, that already starts very early on. So you actually invested in a baby gut health company. Do you want to talk a little bit about this?
Well, as just mentioned, gut health, especially gut microbiome health, is pivotal for the early stage development of babies. It helps you prevent pathogens and help you develop the immune system. Any disruption in that critical time frame are associated with long-term chronic illnesses like type 2 diabetes and asthma. So this offers a kind of a critical window for interventions.
Do you want to go a little bit further into Alba Health, which is the company that you have invested in, what they actually do?
So their technology was based on one of the largest, world's largest baby microbiome cohort called HLTH in Finland, which shows 80% of the children have some kind of gut microbiome disruptions, as well as associated gut symptoms. So based on the insights from the HLTH cohort, Alba Health developed digital solutions that support parents to make lifestyle and diet as well as weaning plan decisions for their baby based on their lifestyle contexts as well as gut microbiome analysis. In this way, preventing some, solving some early stage issue commonly faced by parents such as colic, diarrhea in children, as well as preventing them from long-term chronic illnesses.
Bobby, I'm going to ask you later on whether you want to comment on the baby health, but maybe, Robert, just turning to you. You have set up several companies already. Why do you think gut health is an area you would like to go further into, or you decided to go into?
Yeah, because it is strictly connected with our general health. Let's say there is a saying that our bowels, our intestines are the second brain, right? And just like it was said, this is also very important in terms of 70% of the immunity. From my point of view, doing different startups, but still in medtech, is very important because there is a huge problem with lack of non-invasive diagnostic methods on the market. And no matter if this is a GI tract or some lifestyle diseases, civilization, metabolic diseases, everything are connected. And the mostly reason because we have such a big civilization problem is that people don't want to do the preventive diagnostics, then they don't want to do the laboratory tests because this is a very big barrier for them. According to different researchers, there's only 40% of people really do the preventive diagnostics. 60% of them don't want to do it because of the invasive procedures, different problems connected to it. And the other fun fact is that most of these diseases that we are talking about here are fully curable when detected early. So this is the problem, to force these people to do preventive health diagnostics.
And at Nourica, you are actually using sweat as a non-invasive biomarker, right? Does it link already to digestive health, or what are you looking at?
Yes, it is. However, yes, in Nourica, we want to measure 9 biomarkers, health biomarkers that are visible in human sweat. And generally, the idea is to offer in the future objective picture of human health in the pre-screening diagnostics. So there are biomarkers related to the liver, health condition, urea, creatinine, and so this is the urine system. But also there are some health biomarkers that are connected with the GI tract, that are strictly connected also with the liver. So based on the non-invasive diagnostics, we can also find if something is going wrong with some of the organs, and this is giving a clear information for the patient that should check it deeper, do something, go to the medical doctor, because if, like I said, if it will be detected early, it could save your life.
Saving lives or going wrong is also a good way to bring you in, Martin.
Yeah. Actually, I would like to continue what Robert said about the attitude about the people's attitude concerning the classical diagnostic process. That is why in Biocam we are actually developing a small endoscopic capsule which is actually painless and very accessible to everybody. Everybody can do the examination at home and home environment, and actually that would bring much more value for the patient. What more, we are going to, and we are developing this connection between the device, the technology, and also the AI techniques involved, because we are trying to make a decision support system by automatic recognition of different kind of pathologies of the digestive tract. So these two things, the easy accessible device technology connected with the machine learning, for example, with the AI techniques, it is something very, very critical and very promising in the future.
Sure.
Yeah, I would like to also add some additional, something additional to what Martin said. This is they're also doing non-invasive diagnostics, actually less invasive diagnostics, much less invasive than, for example, traditional colonoscopy, which is quite invasive. But this one thing is offering people the tool that will, let's say, allow them to do this test. Another thing is that the healthcare system in most of the Western, not Western countries are strongly overloaded. There is no money, so this is the second side of the medal, that one thing, people don't want to do it by themselves. Second thing, healthcare systems cannot afford to make it easier for them, do the right screening processes, long-term, widely available, and so on. So this is not only patient's fault, but also the system fault. And they, by offering something that is not only giving the non-invasive tool, they are also limiting the overload of the healthcare system, because all of these examinations can be done remotely and with only minimal engagement from the medical doctors, because they are also limiting 90% of the time that is spent on examination of this, let's say, movie from colonoscopy.
Bobby, as a practitioner, what do you think about this?
So we've been doing capsule endoscopy for a few decades now in terms of looking at the small bowel. So as a gastroenterologist, we can access the upper gastrointestinal tract and the lower gastrointestinal tract. But small bowel has always been quite difficult. So capsule endoscopy is very important from that point of view. I think the thing with any test is, what are you going to do with the information? at the end of the day. So I think if it changes your management, then I think it's helpful. I think if a test is easily accessible for a patient, then your likelihood of compliance is going to be much greater. So I think where I see technology moving, from a personal point of view, is looking at where the friction is in what we do. So workflow automation is a really big issue in terms of access to specialist healthcare. There's a lot that we do that could be automated prior to seeing the patient. So I think that, to me, there's a great opportunity to, get the right data capture and then to use artificial intelligence to help you manage patients. So there's sort of a clinical and business intelligence that comes out of that. I think the other thing that for me is important is how you look at AI for predictive analytics. So who are the patients that are actually at risk of getting sick more quickly? So maybe they're not necessarily the red flag patients, but they're the amber flag patients. I think that those are an important group. And who are the patients that you can safely manage with a digital first approach? So, and this is where I think AI is very important. The other thing that I'd just add is I think there are things like VR, which are very interesting, where you can use VR for training. So training young gastroenterologists how to do colonoscopy. There's some great work that's being done on that. And then VR is being used, again, for things like chronic pain. So that's where I see technology really evolving.
From an investor perspective, what would you add to that, Jan?
Yeah, I think it's exciting in the gut health right now because the market, especially there are a growing number of consumers are aware of the importance of gut health and its application and a wide connection to a wider range of health. So it's not just about gut. It's also about mental health, about immunity, and because of the increasing knowledge, for example, in the gut-brain axis, as well as the impact of gut microbiome in different health and wellness. So I think I would like to emphasize like two key trends. One is the application of AI and machine learning in diagnostic tool, which is Biocam, and also in workflow automation. And also, as mentioned just now, very personalized solutions and gut health, such as consumer health company like Alba and Oberon, giving you personalized lifestyle and diet recommendations based on your gut microbiome composition, as well as customized probiotics, and also even a smart toilet that analyze your stool and track your gastro illnesses. And so for all these technology, you cover the prevention of gut health, gut illnesses, the treatment, and increase the efficiency of the treatment processes and automations. And yeah, overall, it helps the healthcare system, especially the physician, making more informed decision for their patients and also improve the experience of the patient as well as the broader consumer.
You touched upon quite a few different topics, so maybe taking that one at a time. So one question around gut health is behavior change, right? Most of you have mentioned this before. So we all know behavior change is super hard. What have you seen working with the people who either use your products or are your patients? What could actually help people to think about their gut in a different way and make it healthier? Whoever.
Yeah, actually, from our experience, the people are actually waiting for this kind of remote health recognition. So it is very expected from our point of view, from the point of view of our patients. It is very expected.
So I think from conditions like IBS, there's digitally delivered therapeutics. So, there's companies like Nerva, where you can, use them to deliver, gut-directed digital therapy. So I think those are definitely areas. I think you're seeing other products in the market like Zoe, where people are, really kind of being a lot more precise. There's a lot more personalization around around what you eat, which I think is a very important and easy way to tackle gut-related issues. The microbiome, I think, is a really interesting area because first of all, we don't know a lot about it. So I have to put my hands up and say that the amount of data that we have is very small compared to what we need to know. But we can see that there are trends with mental health, cardiovascular disease, liver disease, obesity, cancer, all related to the gut microbiome. So we know there is something there, there's a signal there. But how we manage it and how we change it, we don't know those answers yet. So there's a lot of work to be done in that area.
Yeah, I totally agree. And especially the current state, there are a lot of research as well as data on association of different gut microbiome composition to different chronic illnesses, but then there's no proven causation. So that will bring a lot of barriers, especially when it comes to consumer health startups going into market, because you really have a restriction on what you can infer from your products because of regulatory barriers. Yeah.
I was just going to say, ultimately it comes down to what are you going to do with the information? How can you act on the information? So with the microbiome, we can make some assumptions, but none of them are sufficiently validated at this point.
Is that one of the reasons you co-founded Ohealio also?
So I co-founded Ohealio because I realized during the epidemic that there were a number of aspects of gastrointestinal health that could be safely delivered with a digital-first approach. Things like IBS. So we put a multidisciplinary team around that: dietitians, GPs, gastroenterologists, direct-to-consumer medications and diagnostics. So that was sort of the first part of what we did. And as we kind of built that, we also realized that workflow automation was a massive, if you really wanted to scale access to specialists, you really need to find ways of making specialists work smarter, not harder. And I think that's where I see, on a day-to-day basis, an impact of trying to change. In the 14th century, we'd sit next to the patient and take a history from them. That's what we do today. That's got to change.
How often do startups come to you who think that they have solved a lot of your problems, but you actually think they don't actually know how, what kind of problems you have on a day-to-day basis?
So there are a number of startups that can solve a certain part of the problem. I think one of the challenges that we see is that it's easy to probably fix one element of it, but there's always sort of horizontal problems that are much harder to change from a holistic or from a systemic point of view. So that's where you need the system to be innovative and to be encouraging, to be responsive as well as responsible.
Martin, what if you think about your product, how easy or hard was it to actually bring it into the system itself and to integrate it?
How to bring it into the health system, you mean?
Yeah, or integrate it into the current workflow for physicians or the experience, the patient pathways.
Well, actually, that is a very hard question. But to be honest, at the end of the last year, something really interesting happened, and it was the release of the ChatGPT system. And why it is related, for example, to the health, to the digestive health, because the people started to believe that the AI works and it is really useful. And that was a kind of a game changer also for the physicians. Because now we have a lot of possibilities, a lot of government-funded projects, or the investors, the attitude of the investors is completely different to the AI because it was proven that it is very useful. That is why we are actually doing both the device and the AI technology connected with that device. And we have a lot of interesting ideas for the future. For example, it is not really related to microbiome, but a lot of companies would like to introduce products related to a healthy lifestyle, for example. But the problem is how to prove if these supplements really works. For example, with this capsule, we are able, for example, to make a comparison analysis. If before applying these supplements, what was the condition of the person, and after applying these supplements, what is the condition, if there is any improvement, for example, this kind of improvements and so on.
Jan, from your experience, to what extent do you look at the clinical evidence for microbiome, etc.? Or is that not yet far enough? Because you mentioned that a lot of the products you look at are more B2C products.
For B2C products, it depends on the amount regulation needed, and then refer to the amount of evidence you needed. But at our fund, we are really looking into any kind of solution that directly benefit patients and patients' outcome. So clinical evidence is definitely, outcome measurement is one of the key measures we look at. And it's also combining with one of the main hurdles for early stage startup is that because there is so little known, for example, in gut health and microbiome. As a startup, it's hard to build a huge database and just based on investors' money to formalize these longitudinal studies and trials. So I think it's important that startups collaborate with institutions like universities and hospitals that already have these trials running, and build on the basis of their data and insight, and deliver something that's actually useful to the consumer and patients.
Robert, you have experience in setting up different companies. Do you agree with Yang, or have you seen different?
Yeah, actually, this is the clue, what you said. Most of the tech startups have really low budgets. They're trying to do completely new technology. There's no some procedures you can follow on in order to make this project. And the biggest barrier is that they have to, an example, in Biocam or in some microbiomes company, you need to learn your solution, how to interact with the patients, how to analyze the data, and you don't have the data. Nobody wants to give you the data because this is the proprietary of different entities or other commercial companies. You don't have money to do the clinical experiments on the patients in order only to firstly see how it could be implemented, how it could be fixed, how to arrange this future product based on this. This is the huge problem. That's why cooperation with different universities, medical facilities is extremely important. And also something new, which is happening now, there are some associations that are giving this medical data for free for technological startups. That this is maybe this is not solving the problem. However, this is a good start to finally together have a common, let's say, knowledge on which startups like we can work on.
Amazing. One topic that came up a couple of times were comorbidities with gut health. Bobby, do you want to talk a little bit about why this is so important? And then maybe the others can jump in to say how technology could address those.
So there are a number of conditions that are interrelated. So, for example, diabetes and fatty liver disease. These are good examples of other conditions that are associated with the gastrointestinal tract. So I think there's a broad range of conditions that have some influence as far as the gut's concerned, and so having technologies that can allow you to put a wraparound around this from a diagnostic point of view, from a therapeutic point of view, is very helpful.
Any further thoughts on how technology can actually help to bring it together? Or any wishes for anyone here in the room to take a leap forward in gut health?
So I think it comes down to the data, the data that you collect from a patient. If you really want to pick up, other issues, you need to collect as much data as possible. So if you can, again, going back to the point about workflow automation, if you can collect more data, then actually the insights that you can get make it easier to pick up other issues that are developing earlier.
There's a bit of time for questions. If anybody in the audience has any, you can just raise your hand. I think it's the typical post-lunch situation.
They're tired after the meal, sleepy.
Yeah, absolutely. What can we do about this, actually?
Well, actually, it's normal because when you're digesting, the blood flow going into your gut instead of your brain, so you're sleepy.
Yes, sugar is also rising.
Yeah.
Amazing. So
this is
any
the-
tips here?
Yeah,
We should have done a little gymnastics session on stage.
But this is also the first symptom that something is going wrong with your metabolism. So maybe let's take these people to some preventive health diagnostics.
And guess who founded it and where you can find it. So if you think about the next couple of years, what are you excited about? Because I'm not an expert in this topic, but you guys obviously are. And it seems like in the last few years, there's much more interest in gut health and wider understanding in the broader population, and people actually start thinking about it. So if you're looking forward in the next 2, 3, 4 years, what are you excited about? What could happen?
If I may, I think that a very important issue that was addressed here are the data. So I think that the annotation systems will be a great issue. This is kind of a future for the ML-driven models in health system.
So I agree with that. I think, we've got to make life easier for patients. We need to get patients through the system much more efficiently. Doctors are overworked, they don't want to work harder, but they can definitely work smarter. And I think systems need to be able to reduce waiting lists. So that to me is key. And that's where I think, a digital first, cloud first, AI first approach, I think is great. I think the other thing which we've talked a lot about is the microbiome. I think it's going to be interesting to see where that all pans out in the next 2 or 3 years and how we can influence it.
Yeah, building on that. Oh, sorry. You want to?
From my point of view, this, I'm happy because there is a really growing consciousness of people, partners, technological companies. An example, like you look at the endoscopic capsules. This is the invention from 90s, and actually till this moment it was not improved in some crucial, significant way. Now, many different companies are fighting to provide remote diagnostics, which will be less invasive, which will limit the barriers for the patients, because we need it.
Well, building on the previous conversation, first on the data side, I think the future is on our side. For example, the microbiome testing, genetic testing has been increasingly cheaper compared to previously. The more advanced shotgun analysis previously was much more expensive than 16S. And now it's super affordable, making the consumer health products affordable to everybody. And another thing on data is that there are more and more, not just consumer health, but also other health tech data analytics company bringing data points from other kind of perspective of health, such as mental health and immunity, inflammations together. So putting a more holistic picture of how gut health is connected to your overall health and well-beings.
The other thing, I think, obesity. I think we're seeing a lot of movement in terms of the medications that are being approved for obesity, and I think that will have a huge impact in terms of comorbidities, in terms of society, in terms of other illnesses as well. We can address that.
Wegovy?
Tirzepatide, Mounjaro, all of these.
Absolutely. We could fill a whole another session to discuss all of this. Thank you so much for braving with us in the post-lunch session. All of our panelists will be here in the afternoon. If you have any more questions, reach out to them, and otherwise have a fantastic conference. Thank you.
Thank you very much. Big applause, of course, to our panelists, and thank you for moderating, Lina, this session. Thank you very much.